Hey everyone, it's Reena Jadhav with the Live Longer Podcast and Health Boot Camps, and here with Dr. Brian Mowll talking about testing for diabetes. Dr. Mowll, tell us about what are the traditional tests, what are the numbers, and frankly, more importantly, what I'm excited about is what's coming down the pike. Are there going to be easier ways to track and monitor diabetes? So let's get started. What are the tests out there for one of us to check if we've got any diabetic conditions?
A great question. And if you've watched some of the previous videos, you learned that type 2 diabetes and prediabetes and even gestational diabetes is caused by insulin resistance. So if we really want to test and measure whether or not we're developing diabetes, type 2 diabetes, we really need to evaluate for insulin resistance. And I'm going to talk about that in just a few minutes. But before I get to that, let's talk about some of the standard conventional tests that are done. So generally, most people during a routine blood test at their physician's office will have what's called a metabolic panel, which includes a fasting blood glucose test and several other tests. The fasting blood glucose test is sort of your base test for blood sugar, and it should be between 76 and 92. Ideally is right around the mid-80s, 83 to 85 range. Once it gets over that 90 to 92 area, you're on your way towards developing prediabetes and type 2 diabetes. Prediabetes is diagnosed over 100, and that's milligrams per deciliter. So over 100 but under 126 is considered prediabetes. And once it moves over 126, then it's considered type 2 diabetes. So what we're talking about really here is just a degree of scale. How far along that spectrum or that process are you? It's all the same problem. It all has the same root cause. And it's just a matter of progressing to the point where it's bad enough that you've lost the ability to control your own blood sugar naturally, and that's called type 2 diabetes. There's another test that can be done called a hemoglobin A1C. That's being done more and more. It's a test that I think everyone should get, request it from your doctor, because it's a marker of glycation or damage by elevated blood sugar in your system. It's oftentimes described as a 3 to 4 month average of your blood sugar, which is one way to look at it. It's a more stable test than just a snapshot of your blood sugar like you get with a fasting glucose test. So the hemoglobin A1C test is a percentage of the receptors on the protein that carries oxygen in the red blood cells that have sugar on them. So I know that's a mouthful, probably just confused everybody, but think about it this way. You have red blood cells, and there's a part of the red blood cell called hemoglobin. If that gets sugar-coated or caramelized, basically coated in glucose or sugar, we're going to see that percentage rise. And the higher that percentage is, the more damage that's done to that red blood cell. And then we can extrapolate that to say there's damage being done to the brain, to the heart, to the cardiovascular system, to all the other organs like kidneys as well. So this is an important test, and it should be somewhere between about 4 and 5.5%. So when you get a hemoglobin A1C test, it's going to be a number like a 5.2 or a 6.1, and that's a percentage. So normal is about 4 to about 5.5%. Once it gets over 5.7, but under 6.5, again, we're in that pre-diabetes range. And once it gets over 6.5, again, we're in the type 2 diabetes range. So this is another way of measuring blood sugar. It's a more stable measurement. It's oftentimes used to evaluate how well you're controlling your blood sugar even once you're diagnosed. There's a few other tests that I'll mention. One is a standard lipid test, which is important. We look at cholesterol and triglyceride levels, HDL and LDL cholesterol. And these are important because they're essentially a way to measure how well we're burning fat. And fat burning is really important for good blood sugar control. So when your triglyceride numbers are elevated, over 100 in fact, that tells us that you are not burning fat very effectively and you are likely insulin resistant. So this is one of the ways we can evaluate for insulin resistance. In my clients who are eating a really good diet and taking care of themselves and on a good blood sugar control program, those triglycerides will often get down into the 40 to 70 range. And oftentimes you'll see them up above 100, even sometimes 2, 3, and 400. So triglycerides are an important one to look at. And then the last test I'll mention is fasting insulin. This one is hardly ever done, but if you ask for it, your doctor should do it for you. And fasting insulin is a good way to evaluate whether or not you are insulin resistant. When we become resistant to insulin, we make more insulin to overcome that resistance, so our insulin levels rise. Normal insulin, despite what you might see on the lab reference range, if you get this lab test done, normal is about 3 to 6. And once it gets over 6, we're starting to see elevated insulin levels. When it gets above 10, that's indicative of insulin resistance. There's actually a score that you can do called the HOMA-IR score. It's a model for evaluating insulin resistance. It's used in research. And you need the fasting insulin, fasting glucose number. And by looking at those two, you can actually come up with a score that will tell you whether or not you're insulin resistant. So, but first we have to have the raw data. So need to get that fasting glucose, fasting insulin, and I also recommend a lipid panel and a hemoglobin A1C.
Sounds like a lot of tests, a lot of great tests that need to be done. Now, in our health boot camps, if you do have those tests, we're going to have live calls with Dr. Mowll where you can actually get some interpretation of, ask your questions, get some answers on what does this mean and what do I need to do in terms of managing these test results. Dr. Mowll, how often should someone who's had some bad numbers on these tests, how often should they be repeated?
Typically every 90 days.
Okay.
The last thing I'll mention is that glucose monitoring at home is really important as well. So especially if you have type 2 diabetes or gestational diabetes, if you have prediabetes, it's not often recommended, but I do recommend testing. And in fact, if you're just interested in your own health, I think it's a great thing to look at. You can get over-the-counter glucometers that test your blood sugar. There's some inexpensive ones available at some of the chain stores out there. And you can check your own blood sugar in the morning after meals and really get a sense for what's going on with your blood sugar when you eat and throughout the day. But as far as those main lab tests that I mentioned, about every 90 days.
What glucose meter do you recommend? Because I actually swear by keeping one at home, tracking it, seeing what is it that you're reacting to. I mean, it's a little bit of work early on, but I think if you try it out for a week, you get hooked to it because you want to know how your body reacts to this, big massive meal you just ate. And when you look at those numbers, they're so horrifying that, I no longer eat 5 brownies in one sitting. I've managed to curtail that now because I see what it does to my body and it's not very pretty. So what glucose meter do you recommend?
For both cost and accuracy, I like, there's one called the Precision Neo by Abbott that is sold over the counter. You can get it at Walmart and CVS and other places like that. It runs around $20 and the test strips are less than 50 cents a piece, which is pretty good. So, and it's accurate. It's a good meter. So Precision Neo, Neo by Abbott.
That sounds great. All right. Well, thank you so much for answering those questions on testing. And for the rest of you, make sure to tune in to the rest of the series because there's some amazing questions being answered by Dr. Mowll. And do check out Health Boot Camps for the Beat Diabetes program with Dr. Mowll. All right. We'll see you on the next one.